So in terms of newer diabetes medications, that includes some of the things that Dr. Novakovic was mentioning, such as the SGLT2 inhibitors. We're really excited about this group of drugs because we know that they have definitely shown to not only improve cardiovascular outcomes, things like heart failure, stroke, and heart attack, but also have helped to decrease progression of chronic kidney disease, which is really something new that we haven't seen with any of the other diabetes drugs on the market, to know that there's an improvement in both of the two complications that we worry about so much with our patients. In terms of overall diabetes management at this time, there's a lot of new combination medications that have come out to sort of make lives for our diabetes patients a little bit easier. So combination treatments, which might include something like an SGLT2 inhibitor plus metformin, for example, or things that are sort of in the pipeline to make it a little bit easier. So patients, instead of taking 2 drugs, can actually take 1 tablet, which will consist of both of those medications. So that's become very helpful. Also, one of the newer ways of helping patients as well with their compliance and medications is insulin that also incorporates other diabetes drugs as well, like a GLP-1 analog with insulin, to be given as a one-time injection rather than 2 injections daily. So we're trying to formulate different ways of making the lives of our patients easier living with diabetes by just making their regimen a little bit easier to remember and follow. So that's something that's very exciting to us. In addition to medications, a lot of great diabetes technologies that have really changed the face of the way we manage our patients with diabetes. Some of those include something called a continuous glucose monitor.
Yes.
These are these little devices that you put on your body, either your hand or either your arm or your abdomen. And what it's doing is it's checking your blood sugar every 5 minutes to give you a really accurate assessment of exactly what your sugars are doing. You know, before we had these technologies, people were always talking about checking their finger sticks. They were afraid to check their finger sticks, or they didn't want to check it that often. And this just takes away the need for checking finger sticks. So it really helps for people to understand what's going on with their body, how different foods affects them, how their lives affect their blood sugars, and really helps with their diabetes care and management. So lots of new technologies on the horizon also to help our patients and to help them, you know, manage their diabetes so they don't develop the complications of heart disease and kidney failure that we're so concerned about.